We've had a significant increase in the number of migrants crossing the border into our community. Our hospital saw an increase in the number of migrants seeking care beginning late fall, early winter of 21. They arrived to our hospital emergency room in a multitude of ways. Some patients come to us via Border Patrol, who typically release them from custody upon arrival. Other patients walk in, take taxis, some even come by Uber. As I've said, we're the only acute care hospital in the area, which means diversion to another facility is not an option. We are it. Some migrants come to us with minor ailments, but many come in with significant disease. We've had migrant patients on dialysis, cardiac catheterization, and in need of heart surgery. Many are very sick. They have long-term complications of chronic disease that have not been cared for. Some end up in the ICU for 60 days or more. One of the largest cohorts we have seen are maternity patients who present with little or no prenatal care. These higher risk pregnancies and births result in higher complication rates and longer hospital stays. Due to a lack of prenatal care, many of these babies require a stay in our neonatal intensive care unit, some for a month or more at a time. There are language and cultural concerns with migrant patients. We work through those, but when you consider the volume and associated case management that comes with it, resources have to support this as well. Migrants often require 3 times the amount of human resources to resolve their cases and provide them with a safe discharge as defined by CMS. That effort includes assisting in locating families, making sure they have a safe place to go when they are discharged, arranging and sometimes purchasing durable medical equipment when needed. We have paid for emergency air transport when they need a higher level of care, hotel rooms, taxis, and car seats. We do all these things because it's the right thing to do from a humanitarian perspective, but it also allows us to open up a hospital bed sooner for another patient in our community. None of these expenses are included in the $26 million figure. Our reality is this: we have delivered over $26 million in uncompensated care to these individuals in the 12-month period from December 21 to November 22. That's an auditable figure. Let me assure you, this is not an approximation. That number comes from a detailed review of unpaid patient bills directly attributed to migrant patients. $26 million in uncompensated care is simply not a sustainable business model. While this is a huge number that we have validated, the point is that any number is not acceptable. It is an unsustainable model to have a hospital like ours bear the entire burden of paying for migrant health care. No business or service can survive ongoing large-scale expenses without any offsetting revenue. Because of this surge in migrant care, we've had to hire additional staff at a time when healthcare labor post-pandemic is higher than ever. Every dollar in uncompensated care has a direct impact on our hospital. Migrant patients are receiving free care. They have no ability to pay. We have no ability to bill anyone. We don't know their final destination. We don't know anything about them. We cannot provide completely free care to the residents of our community, so the situation is simply not fair and understandably concerning to them. Let me put this into perspective. $26 million is equal to the salary and benefits to support 212 bedside nurses. The city of Yuma has 100,000 people, and we've had over 300,000 people cross the border here. That's 3 times the population of Yuma coming across the border. We're the only hospital within a 3-hour radius, which means they come here. We've contacted our state and federal leaders, and no one has a solution. They are willing to listen and are empathetic to our situation, but so far we have no solutions or reimbursement for the care. We've been at this for well over a year now. On behalf of our entire healthcare team, I'm here seeking your leadership support to find a payer source for the care we have already provided and will continue to provide in the future, and to put long-term solutions into action that will support our daily commitment to be here for our community for years to come. One hospital should not and cannot bear the health care costs of a national migrant problem that is deeply impacting Arizona and our community. We need a revenue source for the patient population so we can sustainably provide high-quality care to all comers and remain viable for the future.